Some of the challenges we faced as a family back when I was growing up was acceptance of haemophilia. Mum would always go to the school and explain it because we still had the tendency to have some issues with our level of factor VIII.
When I was diagnosed 19 years ago, they didn't diagnose me as someone having mild haemophilia, which technically I am because of my levels. They diagnosed me as someone who carried the haemophilia gene, though I do have issues myself.
Doctors and other professionals wouldn't believe that we had a bleeding disorder because we were girls. I had a girl come to school once whose dad was a GP and my dad said, "You don't have haemophilia."
You'll often encounter doctors who haven't experienced treating a patient with von Willebrands before, so it's crucial that you can help them understand how to treat you.
Sometimes it's a really invisible diagnosis. It's a very invisible and little understood condition. And it's that the myths and misnomers around women having bleeding disorders. To me, that's the big challenge.
So that's been a big challenge for me, coming to terms with the fact that the person that you're putting your care into might need a little bit of help from you. And if you're in an emergency situation, understanding how you can ensure that still happens, whether that's having something in writing that you carry on you or making sure people around you understand your von Willebrand's disease so that they can advocate for you as well. When I was a teenager, there was an incident when I was travelling to work. A parked car reversed into me and it was a bit of an ordeal. I wasn't injured too significantly, but I did have an impact to my head and legs. Being in a country town at the time, we went into the hospital to follow the normal emergency procedures that you would with a bleeding disorder. And the doctors were really hesitant to take any imaging of my head. The doctor that was there was triaging, coming through. They weren't local, they didn't know me or my family, and they didn't understand the risk there. So we had to actually really put our foot down and make sure that the appropriate haematologists were called and that the imaging went forward just to make sure there weren't any active bleeds happening that we were just going to pass by. And
go to your haemophilia centres, get your treatment, get your plans. It's really worthwhile doing it. It changes your life.
As females, we tend to put our other family members first, realising that we do have issues and problems and knowing the basics. Getting a treatment plan, going to your treatment centre, having an ABDR card that actually tells you what's wrong, what to do, who to contact in case you have an accident or you need to have major surgery or procedures, or you even just have dental work done and you don't want to bleed.
Tooth extractions and dental work I've had treatment for, and girly ops. I always make sure that I have a plan beforehand to make sure that there's no major issues.
Educate yourself, because that's the best defence you have. Make sure that you are able to articulate what good treatment looks like if you ever need it.
Don't be unprepared. Access your treatment centre. understand your condition, it's so much better to be prepared and not need help. Being in the situation where you're unprepared and you do have a bleed and you don't have help, or you have the wrong help and it's not enough, when the situation could be so different. Being prepared, being educated, having a good diagnosis, having a treatment plan, and staying in contact with your HTC, to me, that would be the biggest message for women, is that don't be excluded when thinking of your health.